Well, good morning, good afternoon, and good evening, wherever you are in the world. Look, everybody, I got Dr. Yunker here with me. Hello, Dr. Emily Yunker.
Hi.
Dr. Yunker, you are in North Carolina, and you are a very interesting person, especially, you have a lot of things we're going to dig into and how you practice your veterinary medicine. I shouldn't say very, but in the world of holistic veterinarians, you have a lot of differentiating factors. So we'll dig into those. But I want to start with this idea of Western herbalism. It's different, and I want to talk to you about what it means. It doesn't mean you practice herbs in cowboy boots, right?
No, but I
Maybe
mean,
you do.
that would be cool. I do own boots, but I don't specifically wear them when I'm doing herbal medicine. No, um, the term Western herbals is a little bit deceiving. It's really kind of less about which herbs you're using than how you're using them. Um, and I think there's a whole lot of different versions of herbalism. And in vet med, for reasons that are a little funny if you really delve into them. Traditional Chinese medicine has really become sort of the dominant alternative paradigm, and it's great. I use some traditional Chinese medicine principles and herbs, but it is by no means the only herbal tradition. And so the herbal tradition that I most work with. Would be a little bit more of like a folk tradition of using herbs, so where you're using kind of one herb and you're figuring out how to process that particular herb. I tend to use a lot of teas and tinctures as opposed to pills, although there are certain circumstances I'll use pills under. And then the other version of that's sort of, and this is why this is all tricky, like Western herbalism also includes understanding like the individual chemical constituents of herbs and applying kind of some scientific methodology to it. So you can take something like turmeric, which is really more of an Indian herb, but if you use it in a Western type way, then you're going to understand the difference between the whole plant turmeric versus the particular part of that, which is curcumin. And you're going to that gives you some idea of what it's going to do in the body. Um, and we tend to use things separately and then potentially combine them together in particular ways on an individual basis or for a particular product, as opposed to having a traditional Chinese medicine formula, which is essentially a thousands of year old formula that you might make mild modifications to. And it might have like 15 different things in it. And the exact amounts of it are like secretive and like sort of held as sort of like a specific tradition. It's really difficult to replicate that yourself. Western herbals are way different. You get like four things, you know exactly how to concentrate them together and how to make them. And if you're really hardcore about it, you could pretty much make those products yourself. Most of us choose not to. We choose to buy them. But essentially, you grow an herb, you harvest it at the right time, you do the particular thing you need to do, which is not something that you require a factory or a laboratory for. You combine it in the ways that you want to, and then you use it. It's a different way of looking at herbs, and that is the way that I was trained to use herbs and what kind of resonates with me the most. I enjoy getting to know those individual plants and then how to best show their qualities in the situation that's in front of me. So that's, I guess, in a nutshell, what differentiates it from Eastern medicine. Yeah.
Wow, that's great.
Does that make
I would
sense?
love to have I would no, I would love to have you in a room with like if my dog needed herbs, I'd like to have you in a room with like Steve Marsden, Dr. Steve Marsden, and like, another vet that you all three could just weigh in on. Like you could nerd out in front of me on like one or two herbs for my dog. I would just be like, I would be drooling. I love stuff like that. And just to hear the
I
different
will say Steve
perspectives of
Marsden
different.
is Yeah, Steve Marsden is definitely at sort of the top of the field. He has this amazing way of, I mean, I would completely just be in like starstruck if I actually have been in the same room with him before, but like didn't get to have a really cool conversation. I was just learning. But yeah, he actually has a really wonderful way of individually understanding those herbs and the ways they work within those formulas, which is why he can then make his own traditional Chinese medicine formulas. So yeah, he's actually really applying sort of a Western scientific lens to traditional Chinese medicine herbs. And there's not a whole lot of people in the world who are capable of doing that. He is a rarity for sure.
Yeah. Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this. And also, down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show. I find the best healers, the minds of great healers they're wired different. They think of things in a very artistic and scientific way at the same time. It's really impressive to be around them and to hear their thought process and how they theorize things, and it's very, very, very interesting. They're special people. So this Western herbal medicine approach. Tell us a little bit more about how you learned it, who you learned it from, all of that good stuff.
Yeah. Um, I think that, like a lot of young people, maybe even specifically young people in my generation, this seems to be a thing. Like, we grew up like playing video games. Oh my gosh. And all of a sudden I can't remember the name of the video game. The one where you're like heading out west as part of like you're a pioneer, and literally part of the game is like foraging herbs. Like, oh my gosh, I can't remember. I forgot the name of this game. And like literally anybody who's within like a 5-year, maybe even 10-year age range of me has played this video game. And I remember replicating it like in our backyard and like randomly pulling up plants and wanting to pretend to make medicines with them. I think this is a fairly normal kid thing to do. The difference is that I happen to be raised in a household where my parents were always using vitamins, and they sold some products, some health supplement products. So this was quite normal to me. And then like we had books on the shelf that were like, magic plants of the rainforest and healing herbs, and like this was like on my bookshelf growing up. So I had a curiosity about it, and then I had sort of things I could reach for. And so even before I was in college, my goal was to be a holistic veterinarian. Like, I didn't just want to be a veterinarian, I wanted to be a holistic veterinarian. And so I held on to that through all of my undergrad degree, graduate school, and then through veterinary school. And since that was already my goal, I was reading a lot and following a lot of blogs, and I got to, I say experiment. I don't mean that in a bad way, but I got my first really sick kitten, in grad school, and I got to decide I was going to treat her holistically because I didn't want her to be sick the rest of her life. So we used herbs and supplements, and we made a homemade diet, and we did a raw food diet. And then eventually I found some commercial products that I trusted, and through going to conferences and meeting people. And so she got to be my first experiment. And oh my God, am I going to kill this thing if I feed it a raw diet? So that was all before vet school. So when I got to vet school, I was able to really create the experience I wanted. I mean, obviously I had to take all the classes and pass all the classes, but anytime that there was an opportunity to choose something that was integrative or holistic, I did. So anytime I got to write a paper, anytime I got to do a case presentation, anytime I got to choose an elective or where I was going to go on an externship, I went to Auburn University. So I started the Auburn Integrative Medicine Club, AIM, and we became a student chapter of the Holistic Veterinary Medicine Association. And I ran that for my 3 out of my 4 years of vet school. And that got me a scholarship to go to the AHVMA, the Holistic Veterinary Medicine Conference, where I then got to meet a whole bunch of big name veterinarians. And that was super inspiring as a student. And I got to do a case presentation. So, I mean, I was on this path, like this didn't come to me later. This was just always there.
Yeah, right. And what year?
And then
was this?
one of the biggest influences that I had, sure. Let's see, I graduated in 2013. So it was probably 2011, maybe 2010, probably 2010 that I went to my first AHVMA conference. So it's been a little while now. Let's see. And then, so one of the things I stumbled across, I did a lot of reading. One of the things I stumbled across was the works of Susan Weed, who is arguably one of the most famous Western herbalists in the world. And it was at my local health food store. I mean, that's where I got a lot of my stuff. And her information is not specific to animals. But right after I got her book, she spoke at one of the AHVMA conferences. And I got to hear her speak to a group of veterinarians about how she approaches animal care. And she's not a medical professional. So she wasn't talking about how to, treat cancer, really. She was talking about how you approach whole health, in this particular case, mostly goats, because that's what her thing is. And I was just wowed by meeting her in person. And then I was also impressed by her knowledge level. I actually asked her about an experiment I'd had when I was doing research on a specific plant. And my research experiment didn't work. And I was so frustrated because it was basically an entire semester of effort lost. And so I asked her about it, and she knew within 5 minutes what was wrong and how to fix it. And I was just like, whoa, okay. So my respect level was already high, and now it's like off the charts. And so I decided I wanted to study with her. And she's really honest that that's a really challenging thing to do. She's sometimes not the easiest person to be with in an intense environment. As much as she's a lovely person, she is also a difficult person, and she's really honest about that. But I knew that I needed to see this like whole life immersion. I needed to see what this was like. It's just so different than veterinary medicine the way it's taught in school. So I went and lived with her on her farm as part of one of my vet school internships. And got to hang out with the goats all day and harvest herbs and ask questions and get lectures. And it was amazing. And it was hugely influential on the entire path that my life took. So I consider myself a student of Susan Weed and her works. And this one, Healing Wise, anybody wants to read it, Susan Weed, is the one that most influenced me. It gets into the philosophy of the 7 steps of healing. And then she has a newer one that's just really pretty specific to humans. This is her newer one. I love this picture. It's so like Susan-y fabulous. And that one is, I mean, it's very detailed on human health. The philosophy one fits me better because I'm less interested in the specifics of human health. But that's definitely. Now, I also in vet school studied with, I did a study abroad, like virtual course through CIVT with Barbara Fougere, and I got to do a lunch and learn with Susan Wynn, who is now doing a bunch of pet company formulation diets. So I got exposed to a lot once you know who to talk to and how to go about it. And I think that's fairly unique. Most people kind of are in vet med for a little while before they kind of get burned out on it and realize they want more and then go looking for it.
Yeah.
No, that was very interesting. That's a really long answer.
Well, let's go into it and make it a little longer. Tell us about the seven steps. If you can.
Sure. So the 7 steps of the wise woman tradition, the wise woman in tradition is what Susan calls this body of work. And she's real honest. This is not something she made up. She feels like she just sort of distilled a whole bunch of human knowledge into an easy to understand format. And I would say that feels real. Like when you read her works, it's not like she's saying something you've never heard before. She's just pulling it all together. And I really appreciate that aspect of it. So the first step is do nothing. Sometimes she calls it serenity medicine, depending on which book you're looking at. And the idea here is, I mean, possibly this is maybe the most powerful part, is taking a moment and not making a decision immediately. That's what this first step is about. As a veterinarian, this is also the do no harm step. This is the, do you really need to do something here? Let's take a breath before we make an action happen. And I will say that even in, I've worked in emergency medicine for years too, even in emergency medicine, there is almost never a time where you absolutely must act before thinking. That's very rare. Almost always there is at least an opportunity to say to a client, would you like to go to the bathroom and like take some deep breaths and wash your face before you come back in and we talk about this? And so I think that recognizing that this is an actual step before taking any actions is incredibly important. The second step is story medicine. And this one is both really basic, like Google it. And this is like get information, gather perspectives. But this is also really deep work because many of us are just so unconsciously sort of trained or habituated, perhaps is a better term, to just believing a certain type of narrative. Like an example of that, which is, I would say, prominent in healthcare circles right now, is that the germ causes the disease, right? And then there's plenty of people who will say, you know, a lack of robust health or a poor immune system is what causes a disease, or an imbalance or a toxin. Like, depending on what your perspective is, that's the story you're telling yourself about what's going on. Yeah. And recognizing what that story is sometimes allows us to see a different perspective on it. And then we can go looking for information that gives us a different perspective. So this is gather information, but this is also questioning your underlying assumptions. And then the third step is mind medicine. And this is what we would also think of as like energy medicine. And there's a lot of different kinds of energy medicine. So this one's a little tricky as far as the terminology goes, but this is about like what your mental headspace is. Calming the mind so that you can make good decisions. Working on the power of positive thinking in the case of someone who has a diagnosis that's really serious. And there's all kinds of research that having a belief that you can get better increases your odds of getting better. Same with your animal. And so these are things that help you think better. It also is things like homeopathy that are less about like a drug having a reaction and more about what's happening on a spiritual or energetic level. And so, yeah, so I this is why it's sort of called mind or energy. It's less about a physical thing happening in the body. And then our fourth step would be nourishing and tonifying. So this is lifestyle medicine. And this is what I like to point out to people. We are on step 4 before we even get to lifestyle medicine, right? Because there's so much more going on here than just what's actually measurable in the body. But yes, step 4 is about what they're eating, how they're moving, what their environment is like what your relationships are like, what's really going on in the world. Hugely, this is where nutrition sits for sure. And then there's a huge dividing line, and she calls this the Great Divide. And this is everything in the first 4 steps pretty much only improves health. If you, I will say if you get it right, it improves health. I mean, there's a little bit more, like you could kind of screw up diet pretty bad if you really do it bad. But for the most part, as long as you have a good diet, and if you're actively working on improving your diet, you're only going to make things better. There's the dividing line here is that everything after this has negative consequences. It doesn't mean we don't use it, but it means we acknowledge that we have to weigh the risk versus the reward. And the first thing on that is stimulating and sedating. And almost all of alternative medicine falls into this category, whether it's hot and cold from your physical therapist, whether it's acupuncture needles, whether it's stimulate and sedate, whether it's fluoxetine for, actually, no, that's on the next step. Like hardcore exercise, people who really like hot yoga, stuff like that. This is stimulate and sedate. Okay. And you really can do some harm here, right? Like for the most part, these are things that are beneficial when they're done well, but if you do them poorly, you can hurt yourself.
Yeah.
And then the next level is drugs and pills. Yes. Oh my God. I know so many people who have hurt themselves with CrossFit, and I'm not saying don't do it, but I am saying let's not pretend it's harmless.
Don't do it badly.
So then we have, yeah. Then we have drugs and pills, and this is mostly pills, because injectables are in the next category. But pills, even if it's an herb, once you put it in a pill, you're bypassing some of the safety mechanisms of the body, because the safety mechanisms of the body are not going to allow you to take a quarter of a teaspoon of black pepper internally. They're going to be like, absolutely not. You can't even take that much turmeric without, like, unless it's in a capsule. So once you've taken away some of the safety mechanisms of the body, and then you've concentrated and distilled things. So essential oils, for instance, fall into this category. They're a natural product, but they are not without risks. They're concentrated, they're heavily processed.
Yeah.
And so this is real medicine. This is drugs on some level, even if we've labeled it a nutraceutical, even if we've labeled it natural. And then finally, the last step is break and enter. Break and enter is the realm of Western scientific medicine: radiation, surgery, chemotherapy, IV fluids. Let's see what else. Oh, psychotropics. I guess those are kind of, I mean, they're definitely herbal medicine. You can definitely find them in cow patties, but they are breaking the mind. And all of those things are sometimes necessary. If an animal has a broken femur, you can give it all the appropriate nutrition in the world. Unless you find a way to stabilize that femur, it's not going to heal. It doesn't mean that break and enter or drugs or sedate and stimulate are bad, but it means that we're carefully using them with knowledge, and usually in the hands of a professional who's had extensive training, as opposed to the first 4 steps really being everything that we should be doing for ourselves and our animals every day, all the time.
Wow, that's very that's fascinating. Okay, well, so that is Western. That's how do we think about this? That's the wise women tradition, and then Western herbalism is based on that.
Yeah, you could almost apply each of these to some level of herbs. So like a do nothing is like, hey, don't reach for an herb before you think about it. Story medicine would be, what is the story I'm telling myself about the problem so that I can decide what kind of herbal intervention I need. Mind medicine might be your homeopathic herbs and your some of your aromatherapy, more not so much your essential oils, but like literally the smell of a plant. Nourish and tonify. These are herbs that are nourishing. So nettles, oatmeal, sweet potatoes. We don't even think of these as herbs because they're just food, but many of them are herbs. And then your stimulate and sedate would be your adaptogens. So some of your gentler herbs, but they have real effects. They have unilateral like things that they do. Turmeric. And then you have your heavy duty herbs, like the ones that you're using to melt away tumors. Those would fall more into your drugs and pills. And then anything like I gave the example of black pepper earlier that you have to put in a capsule in order to take would fall into that drugs and pills category. Essential oils also there, but they're still plant medicine. And then your break and enter, I kind of already gave the answer to that one, is also your like psychotropic herbs. We're not really using those in animals. That break and enter category sort of loses meaning unless, well, I guess you could still be injecting neoplacine into a tumor or something like that. But we don't do a whole lot of that in animals. So yeah, so you could look at all herbs in this, but you can look at any intervention in the same ways. So I would say that Susan's contributions to the world, one is just this whole 7-step approach to integrated medicine. Like, and she calls it integrated instead of integrative, but it's a kind of semantics. That this is an approach to health less than one specific thing. But yeah, you could absolutely apply it to herbs too. And she does. And this is how she sort of teaches her herb studies, is where does it fall on the steps and how do you integrate these things together?
Well, I mean, it's a framework, and frameworks are really good
Yeah.
for everybody to use. Yeah. So
Yeah.
you founded the Veterinarian Doula, and so for people
Oh,
who
yeah.
don't know what that is, can you tell us what that is, and also tell us about your experience with that work?
Sure. So the veterinarian doula is sort of my like my side project. It's my passion project. I work a lot
Side
with
gig.
moms and babies, and I'm a mom of 3, and this is another kind of weird, unexpected way that Susan's teachings really influenced my life. Her first book was actually Herbals for the Childbearing Year. And she teaches the 7 steps in there, but it was really like a very specific niche interest. But I, heavily ended up using nutritional herbs throughout my pregnancies. Ended up reaching for a few more medicinal level herbs here and there as needed, and it's informed the way that I raise my children, and it's informed the ways I chose to birth. I had my own births. And so once I sort of was done having babies myself, I realized I wasn't done with the realm of moms and babies. And so I got a certification as a doula, and that's kind of been my side project for the last couple of years. So yeah, I've worked, I mean, it is a little ridiculous how many hats I wear on a week. I mean, yes, I work as a rehabilitation veterinarian. I have a certification in veterinary rehabilitation therapy, and that's what I do. But I also occasionally do ER, and I worked ER for like 6 years. And then of course, I'm a mom, and then I have my holistic practice, which of course I integrate my holistic stuff into my rehab work and occasionally even into my ER work. But I also do specific consultations where all we do is talk about how to support that particular patient's needs. And then I also have one day a week where I do consultations as a doula for veterinarians specifically. And I do not actually do a lot of herbal work in there because I'm working with conventional veterinarians for the most part. I mean, occasionally I get to work with a holistic vet, but I mean, there's just not that many holistic vets having babies. So for the most part, I'm working with conventional veterinarians who are having babies on that. So I do a lot, probably
Wow.
too much.
Wow. Now that's really cool. All the wonderful holistic vets that I meet, and I'll put you all in that title, under that title, that header, you're all wearing many different hats. Yeah. So you're definitely you're in that category. You have now been placed in that category, that's for sure. All right, so I want to talk to you about the idea of rotational feeding. So tell us about your feelings on rotational feeding and how you think about it.
Yeah, so rotational feeding, I don't get to do it all that often. Well, I shouldn't say that. I always try to work towards it with my patients. But most patients who come to me have been fed one thing for a very long time.
Oh,
And even people who are feeding a homemade diet or feeding a fresh food diet of some kind, even a few of my raw feeders, are still frequently feeding one thing kind of forever.
oh,
And this never really struck me as like a great way to do things.
oh.
And maybe that was by grace that my parents were very inconsistent people with our pets growing up. And so we were just constantly changing things out and they seemed fine. And so when I got to vet school, and even well before vet school, and was hearing, don't change your dog's diet or you're going to give them an upset stomach, it just struck me as like, what, something is wrong. they're they're not supposed to have, like, no, it doesn't make any sense for any species on the planet to have
No.
so little ability to adapt to a minor change in their diet. Like, that does not make sense. Um,
Hello.
and I still had a hard time wrapping my mind around it, even as I was reading a lot of the holistic stuff I was finding, because most of them were more focused on like the quality of the ingredients and the freshness of the ingredients and the nutrient density, which is all great stuff. But it still wasn't really talking about this rotational part. Um, and then I met Susan Wynn, like I mentioned, when I was in vet school. She came and did a lunch and learn, and I got invited to have lunch specifically with her and got to ask her about this specifically. And her answer was really fabulous. She said that there's actually some interesting research about epigenetics. And epigenetics is about how things that are not in your DNA, but they're in the environment of the human or the animal or even the fetus or even the egg before it becomes a fetus, how those things can affect DNA expression. And it turns out that in the gut, the foods that the animal is eating can affect the way the cells in the body, and especially in the gut, express the DNA. So how those DNA get turned on and off, how those genes turn on and off, and therefore what proteins they're making. So you can modify gene expression by changing diet, which is absolutely fascinating. And her theory was that if you change the diet frequently and you're turning off those genes repeatedly, that it gives the cells more of a chance to catch abnormalities in the genes. And this has to do with like the mRNA and the way that genes are transcribed. And the more chances you have to recognize when something is wrong, the more the body can shut down that cell before it turns into cancer, which is absolutely incredible. So I was like, wow, can we reduce cancer risk by rotating the diet? Maybe. We don't really know, but it seems like a great idea. And then another piece of this, which I think that she pointed out to me, which I really loved, is that it is hubris to think that we can come up with a perfect diet that any one being can eat for its entire existence.
Oh, please.
Even if you do the absolute best you can, even if you have long-term feeding studies, which basically nobody does except the big three, then, and we know their ingredients are crap. So now you get to choose between crap ingredients or long-term feeding studies, and those are your only options. So like, how do we avoid severe nutrient deficiencies, toxins, imbalanced recipes, while still getting better quality ingredients? And her answer was to not rely on one specific thing forever, to change it out. And so her recommendation was to pick 3 different flavors of 3 different brands and rotate through them. She felt like that was a good way to do it. Well, I've definitely gone way beyond that. I'm kind of like, that's a bare minimum. I feel like we can do way better. So I usually recommend 3 to 5 proteins to be on rotation in a dog who can handle it, which is not all of them. And then additionally changing out your toppers and additionally changing out your herbs. And by doing this, we can get so much more variety in that animal's life. And in human studies, they've really found that in populations where people have a more diverse diet, they have significantly better nutrient levels just like in their bloodstream that you can measure, and they do have less incidence of chronic disease. And that is something they can really measure, especially lower levels of autoimmune disease. So I mean, yes, a lot of this is extrapolation, but it's not extrapolated based on nothing. It's extrapolated based upon what we know at this point of the science. And it just makes so much sense. I mean, for omnivorous carnivores like dogs, like,
Yeah.
yeah, they shouldn't be eating the same thing all the time. They should be getting a lot of different things. So that's my current approach. And so far, I'm seeing pretty darn good results with it.
No, that's great. I mean, would you say that, what are your feelings on the the rise, the rise of Instagram and Twitter and social media, Facebook, the rise of the pet nutritionist and the, the focus on nutrition as opposed to food. How do you feel about that?
Um,
Nutrients and food versus food.
yeah, um, I think there's some pros and cons here. I think that thinking about nutrients, it can be kind of useful. Um, like if you know what molybdenum is and what it's in and how it can impact hormonal health, that's cool. And sometimes I talk about that. I mean, random stuff like that with like my vet moms, for instance.
Yeah.
We talk about folic acid a lot in mom and baby circles. So I mean, I think it's interesting, and it certainly helps with the research. From a clinical medicine standpoint, if you can look at three different things and say, whoa, when you grow it like this, it has folic acid levels that are 3 times higher than this. And when you cook it, it has, different bioavailability than when you don't cook it, stuff like that. I
Yeah.
think it's really valuable, but you cannot pick a diet based upon isolated nutrients. It
Mm.
doesn't, I mean, it really is hubris. And I have a hard time being in the same room with veterinary nutritionists who really ascribe to this approach to feeding. And I can understand why, if you come from that perspective, you have so much fear around food. And they're absolutely convinced that if you don't feed something with long-term feeding trials, that everything is going to die, because they feel like if you get one thing wrong, you're just screwed, you know? And
Wow.
that's a terrible way to go through life. And I feel for them.
Yeah, I'm so with you there. I think you said it really beautifully. Um, I call them
Weird.
chasers. They,
Yeah.
they're
Okay. Are we
nutrient
back?
chasing is a fool's errand. Can you see me?
I can see you now. Yeah.
Oh, good. Okay. Nutrient chasing. I Dr. Billinghurst believes this as well. He's had it up to here with veterinary nutritionists because they're acting as if they can design the perfect. They're doing the same thing that all these big three kibble companies do, and whether they're doing it with raw food or cooked food or whatever. And Dr. Billinghurst always says, well, do you feed yourself by spreadsheet or by calculator or by, a recipe every day? Of course you don't. And neither do the wolves from thousands of years ago. And those are still, whether we like it or not, those are the genes of our dogs. So I think it's very interesting concept, topic.
Yeah. Yeah, I tend
Yeah,
to definitely my starting place is always going to be the species appropriate diet, like biologically appropriate, species specific. That's my
yeah,
starting place. And then from there, figuring out how to achieve that in a way that is doable for someone's lifestyle is really what it
sure,
comes down to.
sure.
And I mean, and that's basically what I spend all my time doing, is saying, okay, I know that what is species appropriate. Now, how do we make that happen in your life?
That's great. That's great. Well, I think and it's probably such a hard thing for you as a busy veterinarian, because then you get into a whole education thing and nobody's coming to you to get educated per se. Um, they're it's got to be an uphill battle to change people's paradigms, just really with anything.
See, it's interesting. I don't have to anymore. I mean, I guess I have two parts to my brain. One part of my brain is kind of the part that shows up to the ER and to some extent in my rehab world. And that's like meet
Yeah,
people where they are. What is one step they can take towards better health for their
yeah,
dog?
yeah,
And yes, a lot of times that looks like just adding some supplements or just a topper, like a fresh food topper, to what they're doing.
yeah,
I don't have time to sit there and try to convince people to do things, and it's not, frankly, it's not my job. Their job is to make the decisions for their pet. It's not my job.
yeah,
But I am very much of the, what is one step we can take that feels doable for you at this time to improve what's in that bowl. And then that's kind of what I do in rehab and ER. But then on my integrative side, man, that's what people are coming to me for. They get an hour-long consultation where we sit there the entire time and we talk about whatever it is that they want to talk about. And half the time they're already on a fresh food diet. We're just tweaking it. I pull in a lot of Ayurvedic medicine and traditional Chinese medicine to try to get the energetics right. Or we're dealing with complex skin allergies. And so we're trying to figure out how to do a short-term, not long-term, short-term elimination diet to try to figure out what's going to work for that pet so that they can get off of the HA they've been on for 3 years. Like this. So those things are what I do in holistic world. I'm not talking anybody into anything. I'm helping them understand how to achieve the goals they've already set forth. So they are very different worlds. And I'm very much in a meet people where they're at kind of mentality. And it's really different. And it's interesting because you have to take your ego out of it when you're a vet. And I think a lot of vets are not good at this, but you have to take your ego out of it. You know a lot, but you don't know that person's life and you don't know that animal, at least not like they do. And you cannot make decisions for them. And if you think it is your decision to make and then things go awry, you are going to carry that with you and it hurts. And if you can let go and say, I am here to provide information and services. You are here to care for your pet and make decisions. Then the dynamic is completely different. I'm not the guru. I'm not the savior. I'm a purveyor of information and services.
Right.
And that said, I mean, I care about my clients, but yeah.
No, that's really great. I mean,
this is how we avoid veterinary burnout.
Yeah, I also I think you're spot on. I always say, we have to speak to the existing listening. It's that remember that expression, when the student is ready, the teacher will appear. I think it's a fool's errand to try to force people to get to your place where, that's why I've been doing raw feeding for 25 years. And I want everybody to feed raw, but I understand there's so many factors. So it pains me when I see people online giving kibble feeders a hard time. Folks, they haven't benefited, they're not at the place you are, and you're so lucky that you've gotten there, but you have to give some grace to these people to get to that place in their own time.
Yeah. Yeah.
Yeah. So tell me about rotational. Do you also believe, because I'm so crazy about rotational that, it's all the elements. It's the vegetables, it's the fermentation I use in my dog's bowl. It's the meats, of course. It's the mix of organs. Dr. Billinger says it's balanced over time. It's literally, there is no such thing as perfection, but it's perfection and balance over time by not balancing it every single meal. And he even believes in fasting and also feeding at different times, because again, getting 4 square meals at the same time every day is not a totally natural thing, that the genetics and the way they turn on and off and all of those pathways and all that, it matters. So how do you think about that? Do you get that nerdy on that topic?
Oh yeah. I mean, okay. So this comes down to lifestyle. Have there been times in my life where I was this into it? Yes. When I was in vet school, I was in a long distance relationship. I was married, but we were in different states. My husband was in the military and I was in vet school. And so I had a cat and he had a cat, and never the twain shall meet. And so it was me and my cat living alone in an apartment, and I had to go to class, but I could do kind of whatever I wanted with her. And she, like many other vet school pets, was a research rescue cat who had horrible issues. Horrible IBD. She was so obese when I got her. And it took me a very long time to figure out what I could feed her. And Slippery Elm was wonderful. I know that Julianne would agree with me on that. And it took me, I mean, years to figure out what was going to work for that cat. And yes, I was hardcore about it. We did so many experiments with her. I fixed her. I mean, basically, she did not die of IBD, or it did not advance to feline intestinal lymphoma. She died of other things years later. And so, yes, there was a time in my life when I was a vet school student who had some disposable income because I had an employed spouse and I had a lot of time on my hands and I had one pet when I was doing all of it.
Right.
I now have 3 children and like 3 jobs.
Forget it.
No, my cats get fed at the same time every day and they do not get a starved day. And they have a commercial food base that we add toppers to. And yeah, I mean, that's where we are right now. So like, I
Fair
think
enough.
you kind of, and it was great. It was great being in that early phase with my kitten and like trying to figure out how to make everything from scratch. And like I had, oh my gosh, do I have it? I had I mean, so many people start with this book, but I don't see it on my shelf right now. Um, and it's not even a book I recommend anymore, but a book by a holistic veterinarian that had homemade recipes in it.
Oh, is it
And
Pitcairn
that's
maybe?
what was my starting point was. Yes, it was Pitcairn. That's who it was. Yes.
Yeah.
And yes, I started with Pitcairn and like so many other people. And then I had Natural Cat Care by Celeste Yarnall. And between those 2 books, I figured it out on my own in my kitchen and went to the grocery store and went to the butcher shop. And that
Yeah.
was a fabulous experience. It was so educational and I felt so empowered as a pet parent. It was wonderful.
Yeah.
Um, and I also realized how much work it is and how hard it is to source ingredients and how annoying it is when your cat is dragging raw turkey necks all over your house. And I figured out some stuff. So I think that understanding where you are in your phase of life and what you can do matters so much. And that's where I feel like having those pros around who've been there, done that, and can like walk you through it so you don't have to have all the pain points is really nice.
Yeah. Well, also the proliferation of raw, like pre-made, pre-packaged raw companies, probably that was a while ago, right? So those have really become a big thing.
Yes. Oh
Yeah.
my gosh, it was
And
night and day. It's like I feel like there was the before times and then now. And like it's just so different trying to figure out
that's
how to
funny.
feed raw now than it was even 10 years ago. It's just so different. Yeah.
The before
Like I'm
times.
not that old, but I can still remember.
I know. Well, I agree with you on that. And I was also this person that like his Labrador was like flinging a turkey carcass on my kitchen floor, which at that time, thankfully, was linoleum. But every time I had to wipe it clean. I'm just like, what am I doing? And then you get smart, you know, you get used to it.
Yes. Yes.
That's great. Well, we've delved into so
Yeah.
many things today, and Dr. Yunker, I really appreciate your time today. So if you could give people 3 great tips for the best, healthiest dog and cat, I know they're different. What would you give them?
Um, I would say, let's see, 3 tips. Rotate things. And we talked about how many things, and that includes your supplements. Rotate your proteins, rotate your vegetables, rotate your herbs, rotate your supplements. And the second thing would be think about interventions when it comes to your pet's health of the least likely to cause harm first, and then the most likely to cause harm last. And then anytime you're thinking about the things that can potentially cause harm, think about what you can do to support that animal through that experience. So, for instance, if your animal's about to have surgery, what can you do from an energy perspective, a mental health perspective, a nourishment perspective, an alternative health perspective to help them through that surgery? So, like, think about all of those ways to support well being. And then the third one is that the relationship, I think sometimes people forget this, the relationship that the human has with the animal is possibly subjectively even more important than any one thing we can do. And I see that over and over and over and over again. And in ER medicine, that becomes very paramount because you don't get to work through an entire lifestyle plan with somebody presenting through the ER. But boy, you can see the commitment level that people have and what a difference that makes in their animal's life. So those would be the three things that I kind of have as my take home points.
Could you elaborate on the third one? Like, give me an example of what you mean by that.
Um, okay, so let's see. I mean, there's like little, I mean, they're not little, but they're obvious things. There's some things that seem really obvious. When someone comes in and they're like, hey, my animal looks really, really bad. And I think we're ready to euthanize. Okay. And then the
Mm,
same person in the next room has an animal that looks really, really bad. And there's like, and they say, I will literally do anything that it takes. And obvious, that's obvious. That obviously makes a difference in that animal's life on what someone's commitment level is. And that doesn't just mean
yeah,
finances, that also means the amount of time that they have to
yeah,
spend on this, the amount of
yeah,
emotional capacity they have to spend on this. Um,
yeah,
but the trick here is the nuance part. That part's obvious. The nuance part is when someone has the capacity, because they've done their own inner work, to connect on a level with that animal and say, what is it that this animal actually needs in this moment? Because sometimes it doesn't matter how much time and emotional resources and finances you have, saving that animal is not the right call. Sometimes letting them go is the right call. And the only way that you can make that call in that moment is if you're connected enough with the line. Um, we also have, more lifestyle medicine stuff that says that when you spend time with your dog on a daily basis, and gosh, this is so true for cats, that they live longer. Like cats are not always going to be as assertive about requesting your presence as dogs will. And that's still going to depend on the dog and it's going to depend on the cat, but as by and large. And I don't know how many people I know who are like, yeah, my cat hates me or whatever. My cat doesn't care. I'm only there in it for the food. Well, maybe that's because you haven't pulled out the dangle toy in 4 years. Like maybe that's because you haven't put them on a cat leash and let them wander around in the backyard. Like you have to cultivate a relationship. And I
yes,
would say that this is definitely true for cat people, but this is just as true for dog people. How many dogs, they're great when they're puppies, and then they kind of get stuck in a crate for 8 hours a day while somebody's at work. And I don't want to guilt people for going to work. That's not where I'm going with this. But what
yeah,
I'm saying is, if you are not actively seeking a relationship with your pet and understanding them as an individual,
yeah,
then you are going to have a harder time making decisions for them. It's going to be
yeah,
harder to figure out what kind of interventions are going to be best for them. And it also means that your vet doesn't necessarily know what's going to be the right choice. They
yeah,
don't have that relationship with that animal. They can give you options, but it's your job to say yes or no. And I mean, I've
mm,
had some people who I pretty strongly disagreed with here over the years in an ER setting for the most part. Um, and I just have to step back and say, I don't know their life. I don't know this dog. like, um,
so true.
I don't want to tell too many stories, but I had one in particular. They were, um, they were Buddhist. And this particular family, their practice was that they did not believe in euthanasia. And I've dealt with quite a few people who didn't believe in euthanasia for religious reasons over the years. And most of the time, I don't have a hard time with it. But this particular
Mm,
animal was oxygen dependent. And we knew that if we took this animal out of that oxygen cage, they were going to die really quickly. Um, but also, they were going to die if we left them in oxygen just a whole lot slower. And I felt like euthanasia was the obvious choice here, and they did not. And they sat with that cat in oxygen for a while before everybody could sort of wrap their minds around where this was going to go. And then they removed that cat from oxygen and took it home. And of course, we all knew it was going home to die, but they wanted it to die at home instead of with me. And I still have a hard time with that. That's absolutely not the decision I would make. But then I recently heard a podcast from a human medical doctor who works in palliative care in humans. And he was talking about end of life situations and how there is a part of the brain, which is the same part of our brain that experiences ecstasy, that is activated during death. And that this is basically the scientific validation behind the Buddhist theory about natural death, and why even in humans you don't use opioids, because you're repressing the brain's natural capacities, and then they basically feel like you're preventing their spirit from making this final journey in the most highest good that it can. And right. I don't know how I feel about that. That's very not how I practice. It's not how I make choices in my life. But I can't say that there's not a valid different perspective there. I can't say that my choice is the only choice that is acceptable here. And that's a really hard conversation to have. I mean, even with yourself, that's a hard conversation to have. Yes. And I think it's okay that people really struggle with that. And I think it's okay that we feel uncomfortable with it. I think having uncomfortable conversations with ourselves is really important.
I so agree with you.
And so I think that you have to make decisions for your pets that are in alignment with your values. And you have to recognize that they are not always going to be in alignment with your veterinarian's values. And that's just going to be the way it is.
Sure. I mean,
even good vets, even holistic vets.
Well, sometimes we have, hard pills to swallow. And, in today's world where we're always observing people's lives on social media, and we're so quick to make a judgment call, really all we're doing is we're comparing that person who didn't live your life, doesn't have your genetics, your epigenetics, your experiences, your biases, your everything, and your uniqueness. All we're doing all day long is comparing how we would do this thing in this way, and oh gosh, isn't this the wrong way to do it? It's really complete. It's a fool's errand. It's complete insanity, because I think you're right. It's very hard to do. We all have friends who make, they get bad boyfriends, and we all have, or girlfriends, and you see the train coming, and you want to warn them, and you just go, well, this is their journey. This must be what they need, or, decisions on how to treat themselves and their medical, or the way they eat, the way they supplement. There's no it's really funny. Humans are so funny, because, this is why I enjoy dogs, because and animals, because people are just so funny. They forget the obvious things. They forget, like, guess what? This person isn't, Emily is not Rob. Emily has nothing to do with Rob. Why is Rob comparing himself to Emily's life? Just doesn't make any sense. So, but I can imagine, I mean, whoa, like being in an ER, that is just really amazing and admirable work, what you do, because maybe one of the hardest things you have to do is not pass judgment and not intervene, and just do the best you can for an animal in front of you.
Mm-hmm. Yeah.
So
it is. It's amazing work. It's definitely not something I can do. I mean, like, I can't do too much of it, because you definitely run across a lot of challenging circumstances, and most veterinarians burn out on ER work within 3 to 5 years, if they're doing it full time, because it's not really an environment where you feel like you're living in your best alignment with yourself.
Right.
But yeah, it's important work.
We have more to talk about on the topic. We will do another show together on this last topic we brought in, not this very last one, but the one right before it, which is how people think about, the bond with their pet. I think that's a completely as far as I'm concerned, unexamined in a deep way, an unexamined topic, because boredom,
Yeah.
lack of purpose of your domesticated animals, lack of company, lack of love, lack of being at home, just like these animals are, suffering in so many different ways, and especially when they're older, I think they're dying faster, because of it.
Yeah. Yep. Yeah, it's one of my favorite things to teach when I'm in rehab is teaching people to do massage, because they suddenly have and therapeutic exercises too, but especially massage, like getting to do touching your animal daily in a way that they enjoy, getting to understand what their responses are, where they hurt, where they're tense, how you can directly make that better in that moment. People come back to me over and over and over again and say, we have such a better relationship now. And yeah, it's very rewarding.
Wow. Well, a relationship therapist for your dog. That's a new emerging it's a post 2024 career. Listen up, everybody. You can help. All right. Well, thank you very much, Dr. Yunker. It's been a pleasure being with you today. Thanks for joining us, and thanks everybody for watching
Absolutely.
and listening.